Welcome everyone, and thank you for joining me in another live stream event. My name is Melissa Favela, and I'm the community educator for Southern Caregiver Resource Center, where we care for those who care for others. Today's presentation is Understanding Huntington's Disease, Caregiving, and Support. So make sure to grab something to write on. Feel free to get comfortable, and let's get started. Today's learning objectives will be to learn more about Huntington's disease and its progression, explore the challenges caregivers face when caring for someone with Huntington's disease, and evaluate ways to prepare as a Huntington's disease caregiver. So as you know, we always like to start off with some statistics as to why it is relevant that we talk about Huntington's disease. So approximately in the US, Huntington's disease occurs in about one of every 10,000 to 20,000 people, which brings the total of Americans with Huntington's disease to about 30,000. Now, children of parents with Huntington's disease have a 50% chance of inheriting the Huntington's disease gene, which means that approximately 150,000 people are at risk of inheriting Huntington's disease from a parent. Now, it is important to note that Huntington's disease does not skip generations. It affects all races, ethnic groups, and sexes. Additionally, Huntington's disease symptoms begin between the age of 30 and 55. Next slide, please. So now that we know some of the background information, some of the statistics, let's learn about what is Huntington's disease. What does it entail? Well, let's get started with that. Huntington's disease is an inherited neurodegenerative condition caused by gene mutation in the HTT gene, or also called the Huntington gene. And we'll continue talking about that gene. And this is a genetically programmed degeneration of brain cells, so neurons, in certain areas of the brain passed on by a parent to a child. So this means that Huntington's disease is a genetic disease. The condition of Huntington's disease causes a wide neuropsychiatric clinical spectrum that may involve different combinations of movement disorders, cognitive and behavioral or psychiatric manifestations. And this is underlined because we will expand on this in the upcoming slides. The most common movement disorder is called chorea, and to be more specific regarding the behavioral and psychiatric manifestations of Huntington's disease, it means the loss of intellectual faculties and emotional disturbance. Now, Huntington's disease does require a clinical diagnosis, and it is made through the evaluation of family history, personal history, neurological and psychiatric examination, along with genetic testing. So that is why a lot of the times Huntington's disease can be very difficult to diagnose, or if we're talking about older generations, it wasn't diagnosed at all. Now, there is currently no cure or treatment to reverse the course of the disease. However, many universities, including UC San Diego and UC San Francisco, are actively studying Huntington's disease for treatment, but as of now, it is a fatal condition, although we will talk about how to manage and the things that medical providers are doing to help with the quality of life in the upcoming slides. Now, this slide will give us a brief overview of the genetics of Huntington's disease. It's a very broad, very simplified explanation of what is going on in the genetic plane of Huntington's disease. Now, as I mentioned, Huntington's disease is a genetic condition. To be more specific, it is a polyglutamine disease caused by a CHG trinucleotide repeat expansion in the Huntington gene, which I mentioned in an earlier slide. This gene is located on chromosome 4, and it is inherited in an autosomal dominant pattern. As you can see here, the normal repeat range length of the CAG lies between 10 to 35. And as you can see, that is between the unaffected range here, where it says normal and intermediate allele. Now, there is a low penetrance range from 36 to 39 repeats, whereas patients with 40 or more repeats will most likely express the condition. So that would be the pink area where it says affected, where you see the range where it's 36 to 39 and 40 plus. Now, in addition, there is a strong inverse correlation between repeat length and the age of onset, meaning that the higher the repeat, the earlier the onset. Additionally, as you can see in the other image, children of parents with Huntington's disease have a 50% chance of inheriting the Huntington's disease gene. So if a child does not inherit the gene, they won't develop the disease and they can't pass it on. However, a child who does inherit the gene will eventually develop the disease, and if they have children themselves, their children have a 50% probability of inheriting that Huntington's disease gene. So again, this is a very brief overview of the genetics of Huntington's disease. Next slide, please. Now we're going to talk about the progression stages of Huntington's disease. Again, this is also a brief overview to give you an idea of what is going on in each stage and how is that expressed within the person who has Huntington's disease. So the early stage, there will be subtle signs of the disease with little to no impact in the activities of daily life. There might be mild changes in movement, cognition, and behaviors, but again, they tend to be very subtle. The next stage is the middle stage, and this is where symptoms gradually interfere with ADLs, and it increases movement and cognitive issues that might prevent the person from working or driving. So we definitely see an increase in the changes and the progression of the disease in the middle stage, where it starts affecting some aspects of daily life. And then the late stage is where we have advanced symptoms that affect being able to live life independently. What this means is that the person who has Huntington's disease will require round-the-clock care, which most likely will include some type of family caregiver or some other type of caregiving situation. Next slide, please. Now, let's move on to what are some of the symptoms that can start happening during the early stages. So what are considered the early symptoms? These can include mood swings, depression, irritability, and patients may notice some trouble with their daily activities. As I mentioned in the past slide, maybe a little bit of issues with driving, learning new things, remembering a fact, or making a decision. As the disease progresses, we will start seeing more of a decline in concentration, a decline in short-term memory, an increase in involuntary movements, deterioration of motor functions such as walking, speaking, and swallowing. And then eventually, patients become more unable to care for themselves. And unfortunately, choking, infection, and heart failure are potentially fatal complications of the disease. So again, as you notice here, we do see a combination of cognitive, motor, and other factors that affect the body with Huntington's disease. So it really is a mix of symptoms that progress as the disease progresses in itself. Now, something that I mentioned in the earlier slides is Huntington's disease chorea. Chorea is considered the most common involuntary symptom of Huntington's disease. And chorea is a movement disorder that is related to the release of dopamine in the brain. And it's related to dopamine because that means that there are increased levels of dopamine that cause this chorea, this involuntary movement in the person with Huntington's disease. This chorea can affect the hands, the face, limbs, torso, speech, and general mobility. And about 90% of people with Huntington's disease will develop chorea. That's why it is the most common involuntary symptom of Huntington's disease. Next slide, please. Now let's focus a little bit more on some of the complications that might arise and are related to Huntington's disease. As I mentioned, the changes, the symptoms are a mix of cognitive, physical, and behavioral symptoms. So an example of a complication of cognitive decline would be dementia. So having the presence of dementia as the disease progresses. Then some of the physical challenges related to Huntington's disease include physical injury from the involuntary movements, so from chorea, or falls that can arise because of that. As well, the inability to walk without assistance, infections, and even malnutrition. And malnutrition with Huntington's disease can be related from or can be caused from the motor difficulty in the actual process of eating, or it can also be related to the metabolic issues that are caused by Huntington's disease genetics. So malnutrition may not be necessarily directly associated with physical challenges, but ultimately it could be a result of those physical challenges related to Huntington's disease. And of course, we have been mentioning the emotional impact of Huntington's disease, and that can be reflected in having depression, anxiety, and of course, frustration. And the social implications, which people are social, right? We crave being social, and isolation is one of the complications when it comes to that social aspect of someone with Huntington's disease. Next slide, please. Now, when it comes to treatment, I do want to mention that treatment will be very specific for each individual. Of course, there will be a team of professionals determining what the treatment will be for said individual. But this is just an overview, a general overview of what treatment can be or who it can involve for that person with Huntington's disease. And of course, if you're a caregiver for someone who has Huntington's disease, and you're curious about what the treatment might be, then this could be a simple guide so that you have the tools to ask their care team if this is relevant to the person with Huntington's disease. So treatment might include physical therapy or occupational therapy or both. It might also include speech therapy, of course, counseling, and medications. Now, it is important to note that the medications for Huntington's disease do not stop the progression or do not halt the progression of the disease, but they do help to manage the symptoms that come with the disease. So again, depending on the stage, depending on the individual, the medical team will prescribe the appropriate medications to help manage those symptoms. So again, treatment can look very different from one person to the other. It is something that is very individualized. If you have questions regarding the treatment for someone who has Huntington's disease, I do encourage you to speak with their providers. Next slide, please. Now, moving on to who would be part of the care team, who are our allies as caregivers, as the person who has Huntington's disease, who will be the team that will be helping during this time. Well, it can include several of these and maybe even more, again, depending on what the disease looks like for that individual. So it would include, for example, a neurologist. And the role of the neurologist will be to, of course, help diagnose the disease, but also to monitor and manage the course of the disease, the progression. So neurologist does play a central role. Of course, there might also be a psychiatrist involved, because now we know that some of the symptoms of Huntington's disease include behavioral symptoms, which can include depression and anxiety. So the psychiatrist can help the patient or the care receiver. For example, if depression is prevalent, then they can aid in prescribing and providing antidepressants or other medications that would be relevant to the behavioral aspect of Huntington's disease. Additionally, there would be a genetic counselor, and the genetic counselor can be there to support the individual decision making and possible gene therapy. And of course, as now we know from the past slides, genetic testing is something that is needed to help diagnose Huntington's disease. So genetic counselor will also play an active role. Physical therapists, as I mentioned in the previous slide, they can assist with early balance and walking problems and provide exercises to build muscle, maintain muscle, basically to help the person with Huntington's disease maintain their mobility for as long as possible. And then the role of the occupational therapist would be to provide strategies, maybe to make the home a little bit more safe for them as the disease progresses, to improve communication, to suggest ideas to offset cognitive decline as well. And then there's also a speech therapist that might be involved to address speech, eating, and swallowing challenges. So again, all of these are very important to help manage the symptoms that might come with this disease. And also someone who would be relevant would be a dietitian, because as we now know, Huntington's disease affects metabolism. And what that means is that people with Huntington's disease might need a higher intake of calories due to the presence of chorea, which is, again, the tremors, the involuntary movement. But because there is constant involuntary movement, then there is additional usage of the muscle. And so that means that the body might need more calories to sustain itself and have proper nutrition, and of course, avoid malnutrition. And then, of course, the caregiver, right? The caregiver will be essential to the care of the person with Huntington's disease, because they might end up being the person in charge of coordinating the care for the rest of the care team, right? They might have to schedule the appointments with the neurologist, with the physical therapist. They might have to drive the care receiver to their appointments, or welcome if they're going into the home, being there while the appointment is happening, managing medications, things like that. So really the family caregiver, or if there's a team of family caregivers, will play an essential role in managing the rest of the care team in when it comes to the care of someone with Huntington's disease. Next slide, please. So now we go on to the caregiving for someone with Huntington's disease. Now we know that caregiving can be both rewarding and exhausting. If you are a caregiver or have been a caregiver, you can probably attest to this. We have both sides when it comes to caregiving. Now, caregiving for someone with Huntington's disease can be a very unique situation because of the genetic nature of the disease, right? Now we know that it is a genetic condition. Some Huntington's caregivers may have cared for others in their family already who lived with Huntington's disease, or even they might be at risk themselves if they haven't gone through genetic testing and everything. They might be unsure if they are at risk for Huntington's disease. And maybe in case where there's siblings, maybe they are the sibling that does not have the disease, but maybe they have a sibling that does have the condition, etc. Right? But we can recognize that being a caregiver and a family caregiver for someone who has Huntington's disease is a unique situation. Additionally, Since Huntington's disease is a unique situation and a progressive disease, we know that approximately 90% of the people with Huntington's disease will develop chorea and will need assistance with some element of their activities of daily life, right? We know that that's something that will happen in 90% of the cases. Therefore, caregivers will be key in aiding in the care receiver during the progression of the disease. Now, understanding this disease and its progression and how it affects the symptoms can really help caregivers and the care receivers be better prepared for every stage of the disease, right? So having a better understanding of the etiology of the disease, of why does it happen, what are the symptoms, what will it look like as it progresses, can really be a tool for better management. And maybe not just to manage the condition, but to gauge the need for help and self-care practices. It is known that caregivers of Huntington's disease are at an increased risk for poor health, depression, and isolation. And this can be for many, many factors. The simple fact that they're caregivers, they're busier, there's more stress, there's maybe guilt if they don't have the genes that cause the condition, etc. Right? So again, recognizing that being a caregiver, a Huntington's disease caregiver, is a unique situation. Now, you may find it difficult to talk to other people and really express yourself as being a caregiver when you're caring for someone who has Huntington's disease. It is a condition that not a lot of people know about. So it can be really hard to find that easy, that easy way of communicating with others about what it is to be a caregiver. So when you are telling someone about Huntington's disease and your role as a caregiver, it can help to learn and know this information so that you can relay what it looks like in the physical changes, the behavioral changes, the changes in mood and memory. All of these things are important to know, and it can help those around you to support you as a caregiver. You may find it helpful to have regular breaks as a caregiver. A lot of caregivers learn that the hard way, unfortunately, but it is something to consider that you as an individual, as a caregiver, you need a break. So including those in your caregiving activities and your daily life activities will help you as a caregiver. A lot of people find respite, such as using a day center a few times a week, or in addition, having a group of caregiving support within their group of friends, their group of families, maybe even making sure that you have time for yourself, maybe twice a year, to take a longer break for yourself. This can really give you a sense of relief and rest, and that in itself will help you feel more energized to go back to your caregiving responsibilities. And really, respite is something very important for caregivers in general. Again, it helps with the overall mental health, well-being, and of course, something that I would love to mention here is that if there is a respite worker, whether it be a family member or someone that is a professional and we're hiring, it is important for them to know and that hopefully they do have experience caring for someone with Huntington's disease. Again, the understanding what the symptoms are and how to manage them is very important when it comes to care. Next slide, please. So now let's talk a little bit more about understanding the difficulties and the challenges that caregivers might face in their caregiving responsibilities and day to day. For example, they may experience different levels of stress and different types of stress, and it could be physical stress, emotional, financial, and of course, it's going to have an impact on the mental health of the caregiver. For example, some causes of stress when it comes to the physical aspect of caregiving can be that the caregiver is simply having very long hours of care. There's increased physical demands when it comes to assisting the care receiver with their mobility. There can be increased demands when it comes to feeding, right? When it comes to having issues with the care receiver consuming food themselves. So if the caregiver is more involved in that aspect, that can be another cause of physical stress. And even driving the care receiver to the appointments, right? That means that there's more physicality to the action. So driving to medical appointments or assisting the care receiver with their other activities of daily life, or whatever it may be, bathing, all those things can increase the physical stress of the caregiver. If we're talking about emotional stress of the caregiver, it could be because caregiving is challenging, right? It comes with an emotional burden for the caregiver, whether we like it or not. We can still acknowledge it. There may be some survivor's guilt if we're talking about Huntington's disease being within the family, right? So we can have that guilt of, my sibling has it or my parent had it, and I don't have that gene that causes Huntington's disease. So that is very real. We may also have emotional stress from seeing the decline of our family member, of the person who has Huntington's disease, right? We may feel grief as well, even if it's anticipatory grief. So really the emotional aspect of caregiving can be a lot, and a lot of the times it's not as acknowledged as other types of stress, but it is important to acknowledge it because we need to address it. Additionally, stress can also come in the form of our financials. The potential of having loss of income or having actual loss of income because we need to cut our work hours. We need to go from full-time to part-time to do our caregiving, right? We need to take a leave from work because we need to do our caregiving. Whatever it may be, the financial aspect of caregiving can also be very stressful. Additionally, there can be increased medical expenses that maybe we didn't have in the past, and now we're responsible of them. Maybe even utilizing our savings or making the financial decision of using the care receiver's money when it comes to their care, right? So having the financial responsibility for someone else, using our retirement, or even incurring new debt when we didn't expect to have new debt. So all of this can add that layer of stress when it comes to caregiving. And of course, the impact on mental health, right? All of this can cause anxiety. All of this can cause depression. All of this can lead to isolation. All of this can lead to caregiver burnout, which is something that we don't want. Because if the caregiver is not doing well, if the caregiver is not caring for themselves, then how can they be expected to care for someone else? That becomes very challenging. That becomes part of the balancing aspect of caregiving, caring for myself as a caregiver and caring for someone else. Next slide, please. So that being said, here are some very simple and more practical tips for caregivers. And if you're not doing these yourselves and you're a caregiver, maybe these can give you some ideas or even encourage you to practice these a little bit more if you're already doing them. For example, some of the tips that we can do is that we can start establishing a routine and structure. A lot of times, because when we become caregivers, we're juggling many different things. We're caregiving, we're an individual, we may be a professional, maybe we have children that we're also raising. So the caregiver is wearing many hats, and it can be very disruptive when all of a sudden we're caring for someone else. So what do? Well, we try to establish a routine as much as possible, and we try to establish a structure as much as possible. Of course, this is going to look different for everybody, for everyone, but it is something that slowly but surely can be achieved. So making sure that we're working on establishing a daily routine can really help reduce the stress for both the caregiver and the care receiver. Again, there are many different tools that you can utilize in establishing a routine and structure. If this is something that where the diagnosis is new, then maybe there's a little bit more time to prep depending on the progression of the disease. But it's always good to ask for help and figure out what works best for you and those around you when it comes to routine and structure. Of course, there's also the aspect of the safety modifications. If our care receiver, the person with Huntington's disease, has chorea, then they may have issues with mobility, right? It's affecting their mobility. So making sure that the care receiver is as safe as possible can relieve the caregiver of the burden of being worried. What if an accident happens? And if an accident does happen, having to go to emergency services unexpectedly, all of those can be very stressful situations. So the safety modifications can really help the caregiver and the care receiver have less stress, be safer. So making sure that the home is safe for mobility challenges, and this can include grab bars, non-slip rugs, other safety features, of course. This is where the occupational therapist can really have input. And this, again, will allow the caregiver and the care receiver to have less stressful situations. Again, reach out to your care team, to the occupational therapist, to the physical therapist even. So again, safety modification is a way of being proactive to help avoid stressful situations in the future. We can also include assistive technology, and this can be tools like communication aids, adaptive devices, and this can also be consulted with the occupational therapist and speech therapist to see if it's relevant to your care receiver. And of course, medication management. This is something that is very important. Having a system that's organized with medications and medical appointments, this can be very overwhelming, very stressful for the caregiver. And if we're not organized, this can lead to missing appointments, to skipping medications, and therefore the symptoms of Huntington's disease becoming more prevalent, right? Because now we know that the medications help to manage the symptoms. So really making sure that we have a safe system in which we're organized regarding medications and medical appointments is very important. Sometimes with Huntington's disease, symptoms and progression observation is very necessary, and it's something that the doctors might ask for. So we may have to gauge how the medication is working. We may have to keep a journal if we're noticing changes. And this can be relayed to the care team. And ultimately, this is all for the benefit of the care receiver, but ultimately it is another way of being more organized and having more control over the progression of the disease, but ultimately to help manage the stressful situations that may arise if we're not keeping an eye on these things. So medication management is another very important point in which caregivers can be proactive to help reduce stressful situations. And as I mentioned earlier, finally, respite care. Respite care is a great tool that caregivers can use. It can really impact the reduction of stress in the caregiver. And respite can be through a professional agency or through the team of caregivers within the family and friends. Caregivers can be very organized that way, especially if there is a financial burden. They can reach out to their community and see if they can make a respite team with their community. So really there's different ways of going about this, but ultimately respite is important to give the caregiver the break that they need to recharge and continue with their caregiving responsibilities. Next slide, please. I do want to highlight that Southern Caregiver Resource Center does have resources available for caregivers who are caring for someone with Huntington's disease. For example, we have additional videos, additional to today's live stream, that might be helpful in understanding a little bit more about the nutritional aspect of caregiving. That video is called Nourishing Wellbeing, the Role of Nutrition in Caregiving. And we also have a quick 2-minute video that's called Cooking While Caregiving. So these can be additional resources for you to check out if you're interested in learning more about the nutritional aspect of caregiving. We also have a podcast episode 65, that talks about gentle movement in caregiving to build strength and balance. And this is something that can be for the caregiver, because we know that Huntington's disease can be a very physical disease, requiring the caregiver to use a lot of their physical strength. And so this episode might help you with maybe some tips on how to help yourself when it comes to movement and mobility. And of course, we also have fact sheets that you can print out or save in your computer about Huntington's disease in itself. So SCRC is here to offer resources for you as well. And I'll tell you where to access those in a couple of slides. Next slide, please. So what can we do as caregivers? We can prepare now for the future. If you're caring for someone with Huntington's disease, you're related to them, these are some steps that might help you know if you're also at risk for Huntington's disease, if you don't know yet, or if you aren't, what can you do to be proactive, right? So this is just a simple guide, if you will, to give you some ideas if you haven't done this, how to be proactive. So of course, there's genetic testing, right? That would be very important to speak to your provider, your primary care provider, about if you haven't had genetic testing and you know there is Huntington's disease in your family. So genetic testing will be very important. It is stated with people who know that they have the genetics of Huntington's disease in their family. They say that when they don't know if they have the gene, it's very stressful. Even making life decisions without knowing is very stressful. It impacts how someone may plan out their lives, their careers, they're maybe looking forward to having children or not, all of these things. So genetic testing will be something that can potentially alleviate the stress of not knowing. And then also, if the gene is present, how to be more proactive about care. So really, testing would be a very good idea, or the first step, but always talk to your primary care provider. Additionally, you can seek emotional and mental health support. And this is if you don't know if you have the genetics of it, or if you do, or if you are a caregiver. Having that emotional and mental health support can really be a very big tool to figure out and go about your daily caregiving activities, and especially even more if you are dealing with survivor's guilt or not knowing what life will look like with Huntington's disease. It is important to build a support network with others who understand what you might be going through. So even reaching out to others who are going through the same thing or have life experiences that might be similar to yours when it comes to Huntington's disease in someone's life. And of course, managing the stress of caregiving responsibilities. The more we know, the more information we have, the more knowledgeable we are, the better we will be at preparing for the progression of the disease. You'll have to learn and discuss how you will adapt to caregiving and the needs of the care receiver as the disease progresses. We will also have to talk about difficult topics such as end of life and end of life decisions, making sure that we know those options that are available to our loved ones, such as hospice care, making sure that we're talking about advanced care planning, preparing for the final stages of Huntington's disease. These are very challenging topics, but they are important to discuss and plan ahead of time as much as possible, so that when those stages arrive, we don't have that additional stress of trying to figure out legal documents or not really knowing who to reach out for help, right? So again, being proactive for the end of life care. Honoring the person with Huntington's disease is very important. Focusing on the quality of life, focusing on their wishes as to how they want their care to go, especially if we still have time to discuss those things with them. That is very, very important. And that's another way that we can honor the people in our lives that have Huntington's disease. As I mentioned, just in the last point, making sure that we're aware of the legal and financial considerations. When it comes to legal planning, that there is a power of attorney document present, that there's a living will, that there's guardianships, whatever the legal documents that are needed, that they're in place, that we're aware of the documents that will be needed when it comes to the progression of the disease, that we have those done sooner rather than later. And then, of course, also the financial planning. We mentioned that finances were a source of stress for caregivers and care receivers. So making sure that we're aware what the insurance covers when it comes to the care. Do we have disability insurance? Do we have long-term care insurance? All of these things can be very helpful to know ahead of time rather than when we're dealing with financial hardship or financial strain. And not to forget the power of community as well. I did mention that as individuals, as people, having that social component is very important for both the caregiver and the care receiver. So making sure that we land in a comfortable space of engaging in social connections. And this can be in person, it can be virtual, it can be online communities, forums, whatever works for you. Making sure that there is that aspect of socializing, making sure that, if there are advocacy platforms that you're interested in, that if you're interested in creating awareness for Huntington's disease, there are many different ways where having that social connection can really make an impact in your life, in your community, and beyond. So not forgetting the power of community as well. Now, to give you a little overview of who Southern Caregiver Resource Center is, we are a nonprofit organization here in San Diego County, but we also serve Imperial County, and we offer not just services, but also resources. We pair up family caregivers with our master level family consultants. We do have support groups and individual counseling that are available in both English and Spanish, in person or virtual. And as we now know the importance of mental health and the well-being of the caregiver, these services can be key to your well-being if you're a caregiver. Additionally, we do offer legal and financial consultation, which now we know that it's also very important when it comes to care and end-of-life decisions, and very relevant to Huntington's disease. And as I mentioned earlier in the last couple of slides, we do have educational components that are relevant to Huntington's disease. We also have our TLC and CALMA programs. These are evidence-based programs that I'll expand in the next slide. And we also offer respite. I did mention respite throughout the presentation, and I do want to highlight that Southern Caregiver Resource Center offers needs-based, temporary, supplemental respite for family caregivers. And of course, we do offer a lot of specialized information and other online resources. Next slide, please. Our TLC and CALMA programs are evidence-based programs, and of course, all our services are free, and these are free classes that are focused specifically for caregivers who are caring for someone who has memory loss, Alzheimer's, or another form of dementia. It talks about how to care for yourself as a caregiver, how to manage challenging behaviors when it comes to caregiving, how to not isolate yourself, how to avoid burnout. So really the TLC program is an excellent way to be a better balanced caregiver if you're dealing with caregiving for someone who has memory loss, Alzheimer's, or another form of dementia. Next slide, please. And of course, I mentioned that we do have other online resources. If you're interested in other topics other than Huntington's disease, you can access our information via our iCare portal through our website. And our website is www.caregivercenter.org. We have our quick tip videos in our Caregiver Corner. We have our podcast, which is called Let's Talk Caregiving. We have a lot of these live stream classes, previously recorded classes, on our YouTube channel or on our Facebook channel. And you can also sign up in our digital newsletter to find out what is going on with SCRC, if there are any events close to you happening, or if you want to reach out to us as well. Next slide, please. You can follow us on our social networks. You can connect with us. You can also find relevant information related to caregiving in all of our social media platforms. So if you are interested, you can follow us right away. We are just a click away from connecting. Next slide, please. And finally, if you are a caregiver, whether it be that you're caring for someone who has Huntington's disease or you're caring for someone else, if you're a caregiver, feel free to reach out to us. Again, you can reach us via our website, www.caregivercenter.org. Or if you want to talk to someone, feel free to give us a phone call on our toll-free number, which is the 800-827-1008. or our regular number, which is 858-268-4432. You can reach out to us. We are available to answer your phone call Monday through Friday, 8 to 5. And if we don't answer, feel free to leave us a voice message and we will get back to you within the next day or so. Now, I want to encourage you to explore the information that we have on our website. This video will be available to rewatch. And finally, I want to thank you for your time, for being here, for watching and learning here with us. And we are a resource available to you. Thank you so much and have a lovely rest of your day.